The World Healing Tour movement with your host, Noah Crane. Heal yourself, heal the world. Hello, welcome to the World Healing Tour podcast, where our mission is to help you heal yourself so you can heal the world. Hi, my name is Noah Crane. Each week, we will bring you tips and tools and inspire you to live your most empowered and joyful life. I'm also the author of the book, The Grass is Greenest Where I Am. Because the grass is greenest where you are when you choose to live in a place of no comparison, no competition, and no scarcity. When you choose to live in your own love and light and share your unique gifts with the world, because we are all unique. That's why it's called World Healing Tour, because when we heal ourselves, we truly do heal the world and step into our gifts and purpose and abundance that we all deserve to have in our lives. That's why I bring incredible guests each week to teach you and to educate you more about how you could live your best life. Today, I'm really excited about my guest. I have Dr. Sam and Dr. Dan, a dynamic force in chiropractic care. They are dedicated to transforming the health and wellness landscape through innovative techniques and personalized treatments. At Atlas Clinic, Dr. Sam and Dr. Dan have unwavering commitment to advancing chiropractic care for their patients. Dr. Sam Kearney and Dr. Dan Holsey, welcome to the World Healing Tour podcast.
Hello, thank you for having us.
It's so great to have you guys. I know it's been long. We've been talking about doing this, and I'm so glad we finally did.
Yes.
And I mean, especially that I'm a patient as well. So, to be able to come to your office and have your care is really special for me to showcase what you do as well.
I appreciate that. Thank
Thank
you.
you for having us. Yeah, we're excited to be here. I think it's been over a year now, year and a half since we've met. And I'm excited for what you're doing with this World Healing Tour and excited to be a part of it.
Yeah, and I love that, Dan, you connected to the message right away with the World Healing Tour. Like you just felt like you knew it was something bigger than everything. And you felt the commitment and the love that I had, and that it wasn't about me, that it was more the bigger picture. And I so appreciate you stepping to be a part of it, because I really can't do this alone. Like, I need all the healers to come together, all the people that really believe in a better world for all of us, because we are the change makers. We are going to leave that impact for others. And I'm so excited that you get to present. You get to be our keynote speaker on October 20th, which is a Sunday. And I hope you guys join us. It's going to be the most incredible event. And Dr. Dan is going to teach you how to de-stress and how to connect to your breath and how to live a happier and healthier life. Right, Dr. Dan?
Absolutely. No, and I think it's perfect timing for this type of a launch and a focus, because wellness over these next few years is going to have a massive boost. I think that people are waking up to what's going on with our foods. I think people are waking up to what's going on with just society as a whole. Traditional healthcare, that model has been broken, and people are waking up. So we need to try to find more sustainable ways to utilize what was put on this earth to put ourselves in a healthy environment to allow our body to heal and thrive.
Yeah.
I love everything you're saying. It's so nice. Did you want to say something, Dr. Sam?
Yeah, I was just going to kind of reiterate, especially with a lot of our patients too, a lot of them are not anti the medical field, but they are just looking for something more natural and away from surgery. And surgery is the last thing that they want to do. And it's really inspiring, and it makes me really hopeful for the future of just natural healing and letting the body kind of do what it does, do what it knows how to do, because it does know how to heal us, believe it or not. So.
Yeah, I love your commitment. Go ahead, Dr. Dan.
I was just going to say, it's something that, we're chiropractors. Yes, we do things very differently. However, I think sometimes our profession gets a bad rap, like we're anti-medicine. And there is an absolute time and a place for medicine. If you're having a heart attack, I'm not going to adjust you. Like, they need medical attention. Like, there is a time and a place. I think where the insurance companies got involved, we got a little more on the side of, it's first line defense. You go and utilize all these different structures. And, if you have structural problems, you need structural solutions. You don't need medicine. So there's a time and a place.
I agree. And if you could do it naturally without putting chemicals in your body, why wouldn't you want to do that, right?
At least worth a
100%.
try.
Yeah.
Yeah, so I believe we should always do the holistic approach first, and if that doesn't work, then we can, try other things. But why not? The body heals itself in a lot of ways, right? Would you agree with that?
Absolutely. Yep. You cut yourself. Do you tell yourself to scab that and heal that? No, your body just does it on its own because it knows how to. So, typically we see a lot of times that patients get injured when they're young. Their bodies just heal really quickly because they're young and they were kids and they were playing. And then as they get older, though, their body starts to really speak to them a lot louder than it was before. And so being able to kind of bring balance back to the body and letting the body heal itself the way that it knows how to has honestly been one of the best things ever. Very rewarding, for sure.
That's great. And I know you both are very passionate about what you do. What made you so passionate about chiropractic? Where did this come from, this passion? I know you guys met together at chiropractic school. Tell us a little bit about this and the passion you have for this field.
Yeah. Do you want to go first?
You go ahead.
Okay. So I think both of us are so passionate because we were both patients first. I was dealing with I've had headaches my whole life, ever since I can remember. But when I was 16 years old, I actually got into a car accident and had a concussion, was told to go home and rest, take a week off of soccer, you'll be okay. So I listened and I took a week off, and then I started to notice that I just wasn't really myself. I started to become anxious and depressed. I started gaining weight. My headaches got more frequent, more intense. I started failing classes in school when I was a straight A student before. So things just really started to change. And I graduated college and I kind of had a midlife crisis of, okay, what's next? Like, I have no idea what to do. And my mom said, go to a chiropractor. Go to my chiropractor, go see if she can help you at all. So I went as a patient and just the traditional model, and she actually really helped with my headaches. So I said, cool, chiropractic might be it. So I applied to school, went down to Florida, and started getting adjusted by students, learning how to adjust patients.
And it was manual at first?
All manual, yep.
Okay.
And very shortly after, all my symptoms came back. So school was becoming really hard for me again. My headaches were back with a vengeance. And I had met Dr. Dan in school, and thankfully he knew a technique that I didn't know
Got a
of.
guy.
He said, you have to go. We were over in Daytona at the time, and the office was in Clearwater. Dr. Dan actually made the appointment for me. He drove me 3 hours across the state to get the adjustment done. And the next morning, when I woke up with a clear head at 7 a.m., bright-eyed, bushy-tailed, no headache. It was like my whole life was completely different. It was unlike any other chiropractic adjustment I had ever had. And now over the past 6 years, I graduated with honors from chiropractic school. I've lost weight. My headaches are gone. I've just made the changes that I really felt like I needed to make. And my brain was able to heal itself to a point where I was able to make those changes and kind of make them last. And so thank you, Dr. Dan, for introducing me to this
Dr.
technique.
Dan's a real friend, huh?
Yeah.
That's
so,
amazing.
Yeah.
And now you're in business together.
Yep. So we opened up down here in Pompano, and it's been really, really rewarding.
So let's talk about that secret that Dr. Dan shared with you that was different than anything else you've done before.
Yeah, so it is actually a brand new chiropractic technique that utilizes a sound wave to do an adjustment at the very top neck, called the atlas bone. It is the very top vertebrae in the spine, and it's actually protecting your brainstem, all of the blood flow
Can you
going
show
to
kind
and
of where
from
it
your
is on the
brain.
body?
Yeah, so it's just kind of right up in here.
Okay.
Just that very top vertebrae right below the base of the skull. So I would really have headaches right at that base of the skull that would kind of creep up over the head. And needless to say, it was just a little bit of a misalignment that I most likely had my whole childhood, and that car accident really exacerbated things for me. And one adjustment, and the specificity that we use to accurately fix that problem leads to longer lasting adjustments. So I didn't have to go back 3 times a week to go get that adjustment over and over and over again. I was good after one, and that held, and then my brain healed, and it was just kind of giving my body the power back and the power to heal itself when it had been stuck for so long. So
That's amazing. So the sound wave was able to get your atlas back in the right position?
yeah.
so you could feel better in your body.
Yep.
Can you, Dr. Den, explain more about how the sound wave works?
For sure. The machine is called the Integrity Genesis. Dr. Pierce Jr. and the late Dr. Kelsey Wigginton, they're the ones that prototyped and created that machine. It's the first ever purely calibrated 3-axis sound wave adjusting table. I know you're looking at me like, what the heck is that? The reason why that's important is because our joints are all triaxial, meaning we move in 3 different planes. So my head rotates around the y-axis. I laterally bend and flex and extend forward and backwards on the x, and then I laterally bend left and right on the z. So you have to have a machine that's purely calibrated the way the body moves. They were the first ones that had created that. And the table, it has an electromagnetic striker that drops, compressing that sound wave energy, and it emits it out of a stylus at the end. It's traveling, I believe it's 68 decibels and 2,500 hertz is like the frequency or the amount of force. I think it's like 0.002 pounds per pressure.
So it's all energy.
It's energy that is a mass. So it's, how I would push down on the top of this water and create mass. That's pressure and mass energy being exchanged. This is the same idea, but at a very, very reduced rate. So it's super light, which gives us the ability to adjust patience and keep that bone within normal ranges of motion. And so I think, we were talking earlier about myths and this and that. Where people get scared is when you're taking a bone outside of normal ranges of motion. That's how you create a pop or a cavitation. If I'm just moving with active range of motion, you only can take a joint so far. Passive range of motion, you can push down a little bit further. When you push through and you take that joint through that what's called periphysiological space or out of normal ranges of motion, that's when the ligament laxity could occur. That's where people are worried about, the damage that could occur. This machine emits such a light and focused specified force right on that atlas bone, putting it back into that perfect position that allows the body to have proper brain-body communication, more optimized blood flow. And it's just the accuracy and the specificity, because you're using a sound wave, allows the adjustment to hold. You heal from holding. Holding comes from the specificity. And it's just very difficult to try to have any sort of accountability. What angle is my arm at? Is this 12.2 or is this 12.2? You don't know. So you have to have a machine that is fixed and able to be purely calibrated and adjusted based on the vectors, deemed from the way your anatomy is developed and misaligned.
I love all the examples you're doing. So I could just watch you and be like, oh, yeah.
I try to break it down so you can understand.
Yeah, that's really great. I love that. And yet, so many people do really suffer. They live in their bodies and they're uncomfortable in their body. Why is it important for people to take care of their health and their body for longevity? Like, what do you see? What are some of the problems that can happen if you don't go to a chiropractor, if you don't get yourself aligned with your
I'll
atlas?
tell you this, the biggest, even before we talk about the atlas, the biggest trend I've seen, and we've studied over thousands of x-rays now, even people that have a lot of degeneration and the x-rays are like, oh my gosh, like this person is in bad shape. The ones that were not in bad shape symptom-wise were the ones that had been chronic gym goers, fitness enthusiasts, people that go to the gym and take care of themselves and take care of their body as a whole. They're the ones that focused on better eating, which caused less inflammation. Now, yes, when I'm looking at the picture of the spine, it's almost like it doesn't match the person that you're seeing because they're just there for wellness. They're still taking care of their body. They don't have the same level of pain. But the neck, it looks so degenerative and like this patient should be in a 9 out of 10 pain. The ones that were not having those kind of pain were the ones that focused on their health and their fitness. Now, for those that do have structural damage, why is it important to maintain the atlas alignment for overall body health and longevity was your question? Well, the atlas, like Dr. Sam mentioned, protects the brainstem, which controls functions of the entire body. And a good analogy that I'd want to give you is the reason why med students and health classes teach anatomy and physiology. They're always together, right? Anatomy is the structure. Physiology is the function. Structure and function, very closely related. If you have traumas, if you have car accident, if you have falls or maybe bad ergonomics from 20 years of sitting slouched forward at a desk, all these factors are going to play a role in the health of your spine. Well, if you have poor structure, poor anatomy, because you've lost that structure, your function diminishes. Conversely, if you start to improve and fix the structure, your function improves. They go hand in hand. And for us, the atlas bone is the one that we can work with the most or the least invasively while providing the biggest bang for the buck. And it's because you're going to the source. And I think this is a big thing that a lot of patients always give us feedback saying, man, I really just love how you guys are getting to the source. We'll have a patient who comes in with knee pain and we're looking at their neck and they're like, wait a minute, I have knee pain. Why are you looking at my neck? I understand. But once they realize that that bone is what's protecting the brainstem, which is our main control center, it's organizing all the communication from brain to brainstem, sending it down the spinal cord, out all the spinal nerve roots. This is the bone that dictates the amount and the efficiency of those communications. So it's the most bang for the buck with doing the least amount of work to the patient.
So does everybody that come to the office, everyone, it's always about the atlas, right? Everything is connected to the atlas?
Always the starting point.
Okay.
It's not the end all be all. And this is another debate within our profession. There are atlas specialists out there that solely only work with the atlas and they will not do any other secondaries. I'm not saying they're right or wrong, but the philosophy we believe in is treat the patient. The atlas is a starting point. If you have one side of your back overstimulated neurologically, we can rub it, strengthen it, stretch it, crack it all we want. It's overstimulated neurologically. Okay, where is that coming from? Oh, brainstem. Okay, what bone protects brainstem? Atlas. Oh, it happens to also be the most movable bone in the spine because the anatomy there is so different. We don't have discs above or below atlas. We don't have joints that hold that bone in place. So we start at the atlas. We balance the neurology. We get the body healing on its own because the body knows how to heal. It just needs proper communications and proper blood flow. And now we can start working on the secondaries. We'll still work doing different soft tissue therapies. We'll do adjustments. We'll work with some physical therapy protocols. We have a really cool pulse PEMF electromagnetic healing bed.
That's
so
really
there's all
cool.
sorts of different tricks and tools we can use. But
Yeah, tell us about the bed.
the pulse bed. So have you heard of PEMF?
Yes.
Okay, so there's like other beamer pads, there's AuraWave, there's the Pulse PEMF that we have. Basically, when you, let me back up.
It's very relaxing. It's like a bed that you lay down, right? And it's got like the sound wave in it. Is that what it has?
It's an electromagnetic field that's being emitted with electricity. So the same idea that our Earth has an electromagnetic field that protects it. If you take your bare feet or your shoes off, put your bare foot on the Earth, you will like register like voltage, especially if you held like a voltage meter and then you put the other one in the earth and you held it, you would see the gauge spike when you put your bare foot on the earth versus your shoes. It's called grounding.
Grounding, yeah.
You got it. So that bed is that on steroids. It's close to like, I think 40,000 Gauss of electricity that's pumping through. And you have the ability to tweak the amount of force of those impulses, but think of it like a jump start to every one of the cells in your body. And it's increasing what's called the action potential. It's giving that cell the ability to work at a more rapid rate to start that healing process. So it's an advanced cellular healing
So it kind of speeds
bed.
your healing when you're on there.
That's
And it's
exactly
very
what it does.
relaxing because I do my meditation when I'm in there. I just like want to just like relax.
Patients say they
disconnect.
feel recharged, but also like relaxed at like the same time. And it's like they feel clear, but it's the way another one of the reps has talked about is it's like working out. It's like kind of like the high you get from working out, but that's working out your cells, which is why these guys, the NFL, the MLB, they're all using the same type of technology. So it makes sense.
Technology is really cool.
Yeah.
We got to utilize it.
Yeah, it's amazing. And it's continuously changing and changing. And if you don't keep up, and that's what I love about you guys, that you guys seem like you're so committed to be at the edge of technology all the time.
It's not going anywhere.
Yeah,
So
it's not going anywhere. And I could see like how you guys are using it to really heal people.
yeah.
You know, and
It
makes a
allows
difference.
for safer practices on the patient. It allows for quicker healing times. It's a safeguard for us to where we can't hurt someone.
Less human error.
It's just like, why, I always joke with patients, and if you were going to get some surgery on the shoulder, right? Do you want the guy to come in there with the scalpel, or do you want to use the new Da Vinci robot?
Yeah, choose, right?
Choose. And one of them, and like you look at the studies with the Da Vinci, they're able to heal so much quicker than with someone with the normal practice because they can control the depth. It's all technology. When you use technology to remove or lessen the human error, you have a better chance of higher success. So absolutely.
That makes a lot of sense. All right, we're going to take a quick commercial break. I love this conversation. and from our sponsor, and we'll be right back. World Healing Tour 2 2024, October 20th, at the Wyndham Hotel in Boca Raton. We are looking for vendors, for sponsors, for speakers. If you want to be a part of this, go to noahcrane.com or click the link below. And we are back with Dr. Dan and Dr. Sam. Great conversation. I think people need to hear this because this is part of healing. If you're not healing your body, if your body is sick, I always say, take care of your body so your body can take care of you, you know? And if we don't take care of our body, we're not going to get like a new body at like 50 or 60, maybe one day,
Right.
or 70 or 80. So it's so important to start early. How young should somebody start with chiropractic work and to come to see you guys?
Yeah, I mean, as soon as they feel any type of any symptom ever, absolutely go get help. There's a saying, listen to your body when it whispers. Don't wait until it's screaming at you to go get something checked. I would say even children can be out of alignment, especially if they've ever been in a car accident or had a soccer ball kicked to their face or any type of sports injury. That area is just so vulnerable that damage can be done even with, a bonk to the head. So definitely, if kids are complaining about headaches or back pain, definitely get them checked. We see kids all the time in our office too that have been out of alignment since who knows when, but they're doing much better because they haven't waited 40 years to go get the problem and degeneration hasn't set in yet, and they're young and they're pure and they just heal so quickly. But yeah, and I also think too that especially females, we are always so busy. We're always worried about everybody else that we very rarely take care of ourselves. But I like to remind everybody that you can only help so many people if you are okay yourself. So always make sure that you're taking care of yourself and your needs are met so that you can then go help everybody else that you're helping. So
That's why you have to heal yourself so you can heal the world, right?
Absolutely.
That's the whole,
yeah.
Absolutely. That's very, very great advice.
Yeah.
Also today, I want to talk a little bit about the fact that, we're a forward rotating society, especially with the phones now, the kids, I look everywhere. You just see all the necks down. I keep telling my son, bring your phone up to you. Don't bring your neck down. I'm really scared for this generation as far as their posture goes.
Yeah, we need to bring back tummy time, I think. It's good for adults to lay on your stomach and scroll so that you're not looking down.
Yeah.
Same way
the
kids develop
computers.
their curve.
Yeah.
They develop it on the tummy. So there's functional neurology clinics that utilize the same skills, and they'll bring patients back to almost like foundational elements of how you learn to walk and crawl for cross-brain activity. But for sure, if you're going to be looking up, do it laying on your stomach and scroll for 30 minutes.
Yeah.
It's tough because what do? You can't.
Or lay on your back, right?
Yeah, it's just limit being on the phone. That's a whole nother conversation in itself.
Yeah.
But the phone is like a mini microwave that's just emitting tons of negative EMF. It's not something that whenever I see girls that have it tucked in their bra or tucked in their waistband of their yoga pants or guys who drive with it in between their legs, keep it away from those areas, man. It's not good.
I have one of those EMF things on my phone to help with that. Do you think those things make a difference?
Absolutely.
I do, 100%.
Yep.
Yeah, that's what I heard. So
Yep.
definitely.
There's also shungite is a good crystal that kind of helps absorb the EMF so that your body isn't absorbing it too. So we have some shungite pyramids around our computers in the office too to protect
I have one
those
at home
spaces
too. The
Yeah.
black ones, the
Yep.
black.
Yep.
Yeah, those are really cool. Yeah.
Yeah.
They have the bracelets and
Yep.
yeah, those are really, really
Yep.
nice. Good, that's great. That makes a difference for people. So as far as I wanted to talk about some things that you see that people come in for that you help. Like what are some cases or some stories of people that came into your office that you helped and are much happier with and feel much better today? Can you think of certain cases or certain person that had maybe a real bad knee problem or lower back or
So many.
I'm sure there's so many of them. But I wanted to just ask you, is there anything particular that sticks out?
Yeah, I got
of
one
someone?
lady who, changed her life enough to the point where she uprooted and moved her family down here so that they could receive the same care. And
Wow,
yeah,
that's cool.
she was barely able to walk when she first came in. She is She does. She has a little bit overweight, and a lot of the doctors has blamed her weight for her health conditions and the pain that was in her foot, the pain that was in her knee, the chronic sciatica that she had, the brain fog that she was constantly dealing with, the unsteadiness. I wouldn't call it vertigo, but she always described it as just didn't feel steady. The room wasn't spinning, she wasn't spinning, but something was off. She was in a bad car accident 6 years prior. She had been to a bunch of other doctors. She had tried traditional approaches, and no one had ever looked at or assessed her atlas. They did everything but look at the atlas. Luckily, she found us. That's where we start. So we were at least making up for lost time. It was within, I want to say, 2 months. And she is now like in the gym, a full fitness program. She runs. She goes on the beach and walks 2 miles. She has no more brain fog. The foot that her other podiatrist said would never heal because of like a neuroma that they removed. Some sort of a compression in the foot with this nerve. I'm not sure exactly what it was, but they did a surgery on the foot. And they said like she wouldn't be able to have the function with that foot. It was literally just not getting communicated with. And so once we had cleared that interference, she just took off. And it's been awesome to see what we've been able to give her back in her life and now the different things she's able to do. And enough so to where it impacted her to where she uprooted her sister and their family and brought them down here.
That's amazing.
And now the kids are receiving care, and even to see the transformation in the kids, because now all of them are under care. And when the 13-year-old, when she first came in, she was a little more rebellious, and they had been going through some challenges, so she was, in a little bit of a protective shell, and you could tell she was a defense mechanism. She just was trying to keep herself safe. I wouldn't say rude, but she didn't have the normal social manners of like just talking with the front desk person or your simple, hey, how are you? Oh, I'm good, how are you? Like there was just no communication at all. And to see the shell that she's come out of, now she stops by the clinic, drops off my mom like a little treat, or will pop in, and it's just like, it's dramatically changed their life. And not like, and it wasn't just the adjustment that did it, but it was the support of the office. It was the support of the staff. It was the type of support we could bring with our network to them to give them different services and give them different help that they did need. But it all came from an Atlas adjustment that changed her life, that then allowed her to bring her sister and their whole family down. And now it's trickled down to where the kids are on like a positive path. And it's just like, it's so cool to see.
That's so heartwarming.
Yeah.
I love that story. That is so cool.
Yeah. Some cool, interesting ones.
Yeah, interesting
we
cases
had
are fun.
a 16-year-old female who came in with avascular necrosis of her talus bone, which is
Yeah.
it's the bone is essentially decaying because she's not getting enough blood flow to the area. So she's
Which bone is it again?
her talus. It's one in the ankle.
Okay.
Top bone between like the ankle and the leg.
Yeah. So she came in a boot. She couldn't put full weight on it because it was so painful for her to walk. So doctors put her in a boot, and she's been in a boot for the last 6 months. Well, we adjusted her atlas, her neck, and she came in a week after her adjustment, and she said, "Can I take off my boot and just try?" And I said, "Sure, go for it." And it was the first time in 6 months that she had felt no pain putting weight on her foot. So that one was really cool, coming in for an ankle complaint. And, as you educate the patients about the neurology and what could be controlling that, just because you have an ankle problem doesn't mean I only want to look at your ankle. I want to look at you as an entire human being and make sure that you are okay, and that the nervous system and that the blood flow is able to get there and it's not being compromised anywhere else. So that was just a really fun case.
That's the holistic approach, right?
Yeah.
To look at the whole body.
the whole system.
human,
Yeah.
the person.
That's a
Yeah.
great story. I know that you've helped Kevin too. Kevin from he told me that you've made a huge difference for him.
Well, and like that's a patient that was told by multiple doctors that like his neuropathy is never going to go away, and the pain in his feet and the pins and needles and the dead foot that he was experiencing was because of trauma that he had in the past. That might have been the catalyst that kicked it off, but the root cause was his atlas bone was severely rotated because of the car accident that he was in. So to be able to put him back to a more genetic neutral and give his body the ability to heal, that's the thing. When we live for 20, 30 years with compensations, one side of the body tighter than the other, compensating for a side, it's imbalance that causes more degeneration in a certain spot. And like, we were chatting earlier with Ben, he has, degenerative discs or whatever is going on there from that accident. Well, it's not a disease based on aging. It's a disease based on an imbalance of posture of the muscles supporting that region of the spine. And I guarantee you, if we take an x-ray of him, we will find a ton of discs that are completely healthy. So it's not about it being a disease someone has. We need to take care of the root cause, which typically it's the atlas because it's the most vulnerable bone in the body.
Yeah, it's amazing. It's amazing that such a bone, a little bone up there could control the brain and control the body and control
Well, I would
everything.
say regulate, but
Yeah.
think about this from
Yeah.
a standpoint of
Regulate, yeah.
nerves, or let me back up. What controls your muscles, right? Nerves. What protects the nerves? The bones. If we have a functional issue with a muscle or with an organ, we have to look at the alignment of said bones to ensure first the nerves are even talking. If they are, okay, we can start looking deeper and deeper, but at a starting point. If there is a slight rotation because of a trauma, it's pretty logical to just locate that, remove the pressure, allow it to communicate and heal, and you're good. At
Yeah.
least start there.
Yeah, that's amazing. So does somebody with like a hunchback, you know, because some people like my father-in-law, his back was really hunched with age. So, you know, I feel like we forward rotate a little bit all the time before we know it, you know, if we
Yeah.
don't pay attention to our posture and if we don't go for regular, you know, making sure that we're not out of alignment, we're not compensating with our body, right?
Yeah.
Whatever it is, you know better than me.
Yep.
But is there a way to reverse stuff like that? Or is that like if you're forward rotating already, your shoulders are forward, is there a way
Depends on the age.
to strengthen?
Yeah, I would
something
say
like
it
that?
depends on the severity of the degeneration that's present in the area. But curve changes are absolutely correctable. And posture, the muscles that are controlling all of the posture in your body, they are being controlled by the relationship of the atlas bone and the bone right below it. So in order to have a balanced muscle tone protecting your spine and being able to hold us up in proper posture, you have to have a good alignment of the atlas bone and the bone right below it, because that is what's sending the signals directly to those muscles. So very commonly after we adjust an atlas bone, I'll hear patients say, I feel like I grew an inch taller. I feel like I'm standing so much straighter. Yeah, we just fixed the posture muscles that are now working properly to keep you up. But if they're working improperly, well, we have gravity on us all the time. We have technology now where we are in this constantly flexed position, and over time that will definitely cause damage to the spine, and it will just kind of make it a longer road to recovery, to kind of get things to straighten back up.
And again, back to what we said, the atlas is the starting point. And like all of that, what she just said, sets the stage so that now when we start doing our corrective rehab, or we start working with our physical therapist or our personal trainer, all of a sudden now we have the ability to really heal. And it's the correct order of operations that allows us to do it. And depending on what you said about the severity, there may need bracing. They may need to go a little bit further down, but typically these things can be reversed. It's just targeting and fixing imbalances.
Yeah.
Makes sense. I see too many young people with horrible postures, like young people, not older people. I feel like you guys, I don't know, this is just an idea that popped into my head. Like, wouldn't it be cool if you guys went to the senior citizens home and gave them like some kind of a discount to come in and see you guys? Because I just feel like older people too really, like even into the school, I mean in schools maybe not, but older people, they have retirement, they have a lot of money that they could come, they could feel so much better, you know, because they're so sanitary, you know, they're
Oh,
just
we treat a ton of Medicare
Yeah.
age individuals, and like they
that's
typically notice it the quickest because they've been dealing with it the longest. And so it doesn't mean that their healing is the quickest. And we know that as you age, the body's healing process does slow down. However, when they've been out of alignment for so long, it's like such a big perception of change when they start to finally feel clear. And, you know, all of a sudden that knee pain that they were told like needed a replacement, all of a sudden, well, you know what? Like, actually, the pain's been going away. And like, oh, well, yeah, no wonder your hips are balanced, posture muscles are balanced. There's not extra pressure on that one knee. So, no, you're spot on. It's good for all ages. And back to what you said earlier about should kids be adjusted? My daughter's 19 months old, and
she's
she
such a cutie.
absolutely was. Thank you.
yeah, such a cute.
She absolutely was checked right after she was born, and I would have probably never thought to do it. I heard of all the stories about how you should check them right away, but after watching the doctor pull her head and twist to get her out, I like see how vulnerable those structures are, and I see the amount of force that happens, and that was a normal birth with no issues. And so I see the amount of trauma, and I think you hear the word trauma and you think it has to be tied to some sort of an emotional, like tragic event. Trauma can just be simply like you hit your head funny getting into your car. It's just the wrong angle that caused a little bit of trauma on that site, and you wouldn't register it as trauma. But to that region that's so vulnerable, for Emma, she was struggling to latch, and it was like day 7 or 8. And so it was like, hey, you know what? Let's just take a little feel here. And on one side of that atlas, it was just a little more stuck, a little bit fixated. And for babies, they don't get twisted and cracked. That's not real, and that's not what it is. Light vibratory pressure on that bone, and it just slips right back in. And literally that evening, she latched and started feeding again. We've had babies that come in with torticollis. We've had babies with like reflex issues. There's a couple 6 and 7-year-olds that we're working with right now. So it's never too early to be checked.
Yeah.
That's great. I think what you're doing is so important. And I love that it's non-invasive,
Yeah.
because so often you go, I actually got injured at a chiropractor one time. My knee got injured and he had like a really big ego. Like he thought he was like the best thing ever.
Chiropractic's not the problem. Ego is the problem.
Yeah, the ego was really, really big. He was like, oh, there's nobody like me. I'm like the best. And, and he literally like injured me more. I came in, I think, So I do think that you have to be really careful who you go to and make sure that I like the non-invasive techniques that you guys use, because you don't have to worry about hurting yourself,
We aren't healers.
Yeah.
We are facilitators. We are clearing interference, and we're putting your bones back the way it was intended to be, and then your body is healing. It's not us.
But then it also takes us back to treating the older population, because their bones are brittle and you don't want a whole lot of force and thrust. They don't move the same way that a 19-year-old does. So in being able to use a sound and have them not feel it, it's really cool.
That is
We've been
great.
able to adjust. Our oldest patient was a 93-year-old woman that had 2 cervical neck fusions, and she was in for sciatica, and no chiropractor would touch her. We didn't have to use a sound wave.
Yeah, that's amazing. That is great. All right, we're going to take another quick commercial break from our sponsor, and we'll be right back with Dr. Sam and Dr. Dan. The Grass Grows Where I Am, an incredible anthology book that we are bringing collaborators together. This book is about wisdom, resilience, empowerment, and enlightenment. Do you want to co-author with us? If you do, go to noahcrane.com or click the link below. And we are back with Dr. Dan and Dr. Sam. We're having a great conversation here. And I wanted to ask you about, you're also educators. And I know you educated at my favorite place, Hippocrates Health Institute in is it West Palm Beach?
West Palm, yep.
West Palm Beach, yeah. It's a healing place where people come in from all over the world to heal themselves from all kind of elements. Tell me a little bit about that and about the teachings that you do there and why you're so connected to Hippocrates and what they're doing.
Why don't you go ahead? You want to tell them about Dr. Days and what we do?
Hippocrates is an all-natural kind of wellness institute. So they kind of have, honestly, anything that you could ever imagine.
55 acres.
Yeah, right here in West Palm Beach. But they are very on the holistic mindset of cleaning out the body so that your body can work the way that it should work. So they are very strict with raw vegan diets and their green juices and their wheatgrass shots. And patients go and they stay for a couple of weeks and they just kind of unlearn all of the bad things that they've learned and kind of relearn what's the best options for them and how to take this lifestyle with them when they leave. And it's a really, really, really cool place. And it works very synergistically with what we do of the body heals itself. You just got to give it the proper environment to do the healing in. So we are up there every 3 weeks. We give a little talk called Brain Health Boost that just kind of talks about the importance of the atlas bone, that area, and how we fix it, why we do what we do. And so if you are interested in that, you contact us and we'll get you our dates that we are up there. But it's a really great place. They also have something called Doctor Days where if you're a practitioner in the area, you come down and you stay there for 3 days and you kind of learn everything about Hippocrates, the lifestyle. and everything about their campus, and just so that you are just a more educated practitioner out there in the world. So it's a great place, and there's a lot to learn over there at Hippocrates.
It's like a wellness clinic, a spa, and a school all in one.
Yeah.
It's just like fully encompassing. And there's tons of great healers and health professionals that work there on a spectrum of different modalities that they have. And they've brought in a lot of the top technologies from around the world. I think one of the machines was a German-made machine, but it's they're next level. And it's been wild to even hear some of the success stories that they've had with helping reverse stage 2 type kidney cancers with individuals. And I mean, they're taking people that are sick, and then they have the CEO who just needs a reset. So, you know, they have all the different types of guests that are there.
No, it's great. My in-laws stayed there for 3 weeks.
Oh, nice.
And my mother-in-law had issues, and they stayed there. And they didn't take, once they went home, they kind of didn't really follow up with the care, with the same thing. But, it was a great experience.
Well, if they can take 20%, 25% of that curriculum and try to infuse it into the life, and it's like, you might not quit meat completely, but maybe you eat a little less and a little more vegetables. That's a win.
Yeah.
That's a win.
Yeah.
That's true. That's true. No, it's a great place. And how did you guys connect with it?
It was actually a lady named Caroline Bryan.
Yes.
She we met at an event, and we told her about what we did, and she just instantly, I think,
awesome.
loved us as human
Gravitated
beings,
towards us,
and
yeah.
it was just kind of
I
this
love her. She's
universe
great.
that brought
Yeah.
us together. And
That's so special.
yeah,
right?
she
That's
is.
really cool.
She's amazing.
That's really nice that she works with you guys, and she brought you in because they don't just take anybody in there to
No.
work.
No.
And
Yeah.
you could come there and you can eat, you can have dinner,
Yeah.
right? And then come to
Yeah.
listen to you guys speak.
Yep.
So it's really cool. Are there any other dates on the website at all, on your website, or is it just on?
So we're in the process right now of moving
Okay.
it to a Tuesday. We've always done every Thursday, every 3 weeks. I believe our next one is going to be either October 1st or October 8th, which is going to be a Tuesday.
Okay.
I'm waiting to hear back
Just
on
don't
which
do
day
the
it's going
just
to
don't
be.
do the third Tuesday because that's the holistic chamber.
Oh, well, as long as we pick the right one, it will never.
the
Well,
one conflict,
eventually it
hopefully.
could conflict, but
Yeah.
we'll make sure to prioritize.
Yeah,
We'll
yeah.
take care of it.
That's awesome. So I want to ask you, is there anybody who doesn't need a chiropractor, or does everybody need to go to a chiropractor? Is that like, is going to a chiropractor like your wellness? Like, what's your thoughts about that? Like, should somebody just living their lives, they're not like experiencing any pain or anything, but they want to be well in their life. They want to feel good in their lives, long term, right?
Yeah.
Would
great
you say?
question.
Yeah, it
I
is
was
a
just,
good
I was just,
question.
I was just curious. Would it be
Yes,
something
absolutely.
that somebody would just be like, you know what, like I want to just see how my atlas is. I don't know if they would think atlas, but my
No, they should check in on
alignment
their
or-
body. And here's the thing. So
Absolutely.
when you talk about chiropractors are doctors of the nervous system. Your nervous system controls the entire body, all the organ function, the way your body metabolizes, the balance of hormones, the balance of muscles that connect the spine. That's the nervous system, right? So yes, I think everyone should go see a chiropractor and get checked to ensure that your nervous system is working at an optimal efficiency. People need function, people move, people fall, people have accidents, and I think it is one of the most non-invasive ways for you to fix your body and allow your body to heal naturally. I don't think it's a substitute for medicine or for physical therapy. I think every single one of them has their place. But if you're someone who is looking to take care of your body long term, chiropractic is like anti-aging for the spine. So yeah, if you care about the health of your spine, you should.
And there's also new technology out there to where you don't have to go 3 times a week for like the rest of your life. It's not like a huge burden on your schedule, but especially if you're not feeling pain, like go get your spine checked, make it quick and easy for you and the doctor, and then just maintain that over the course of time instead of having to go multiple times to heal from an injury that you just had. It's much easier to be proactive than it is to be
It's like servicing your
reactive.
car. You want to drive it for 20 years and then go get it checked? Or do you go like once a quarter and get an oil change and you like get a tune up and you make sure the alignment is good so that the joints aren't rubbing improperly? It's literally no different.
Yeah.
That's your body all day long, every day.
Yeah, just have to make sure you go to the right person.
Yeah.
Yes.
Yeah.
And here's the thing, there are just as many good chiropractors that are out there, there are bad chiropractors, and you will find that in every single profession. And so I think as a general guideline, I have no problem saying that when you're searching for that chiropractor, find at least someone who works with the Atlas and is proficient in it, and then look for someone who is not using different straps to yank on the head, not excessive rotational adjustments. There are ways to still adjust the neck and the body in a controlled manner with rotation and accurate adjustment, thrust. There are ways that you can use sound waves to keep yourself even safer if you don't even want any twisting or cracking of the neck. But chiropractic as a whole works. Like you said, it's the ego that gets in the way. And it's people thinking that they're the healer, and you're not.
Yeah, I love how you say that you're not the healer, you're just there to facilitate the healing. I love that because, like you said, the body heals. And you're right. When you, like, I'm the healer, it is ego, right?
Well, it is.
I'm
Absolutely.
the, some
Yep.
people, guru, right?
Yeah.
Well, who's a guru? The only person who's a guru is you, for you, you know? Like, don't put anybody on a pedestal, you know? You should always
And
put
I don't want
yourself-
that to be an excuse for a lack of accuracy. I have no problem putting my ego aside to say that I use spinal engineering software to measure. And yeah, I don't use my hand to feel, because you know what? I don't care how long you've been practicing. You don't have x-ray vision, and you don't know if that bone is grown abnormally or if there's something inside that you can't see. So yeah, I'm not going to try to pretend that I'm some magical palpator of the spine. We're just going to take a picture and measure with software so we know exactly what we're doing to the patient. Very
Yeah.
logical.
And that's by taking the x-rays and seeing what's going on.
Absolutely.
Yeah.
Got to take a picture.
Yeah.
You got to see to know.
I love that. I love your mindset and your thinking and I just feel like you guys are like young, but I just feel like you guys are you're just advancing so fast that, like, I just want to see where this goes, because you've already, you have such, such good energy, and people are really drawn to what you do. And I just love, because you guys really want to make a difference, and it shows in what you do and who you are. And I personally, my testimonial, I personally have definitely feel like I'm walking taller. When I walk, like almost like this from the waist up, I just feel like it's lifted. It's like this feeling like it's lifted, where before I really felt like kind of like more like hunched over, and now I really feel more open.
Good.
So you guys have really helped me, and especially I had a couple of accidents. And the second accident I had, I came and got adjusted by Dr. Dan right before the accident that day. And so when I had that accident, I was probably in much better shape.
Yeah.
Because
Absolutely.
than I would have been if I wasn't getting adjusted. So I literally got adjusted like the day I had my accident. And it was I think I was going like 30, 40 miles an hour. So it made a huge difference.
Yeah, you were stable. Everything was in place.
Yeah.
Versus it exacerbating something that was already imbalanced.
Yeah, so that made a huge difference.
Makes
So-
you less injury prone.
Yeah, and I'm so grateful for what you do, and I'm so grateful that we get to co-create things together to
excited.
bring value to people and to help others, because we all know that the healing, we all need support with it.
Yeah.
Nobody can do the healing on their own. Like we are our own healers, but we also need the support of others. And so to have people out here doing this work and making a difference for all of us is such a gift. So thank you for what you do.
Well, and thank you for what you do too, because the Holistic Chamber, we have met so many great people that have minds just like us, and you out here doing the World Healing Tour and just getting the information out there to the people. So thank you for doing what you do too.
We're excited.
Yeah.
The Atlas and chiropractic, it's a great starting point, but it's a piece of the pie.
It
And,
is.
like,
I
it's
see
mind,
it.
body, spirit. And I love your energy, and I love your focus on, like you said, assessing the individual as a whole and providing all these different modalities and speakers and the network that you're growing to allow someone to come into your network and heal. It's just like, it's powerful. And I'm excited for this conference because we have people from all over the world who are flying in. It's- I mean,
Australia, Canada, India, and Greece. The
Awesome.
speakers. I mean, this is unbelievable. And we have
wild.
Dr. Dan that's going to be speaking.
It's gonna be awesome.
It's going to be like through the roof. The energy, the people, I'm telling you guys, this is, I don't know, something's bringing us together, and it's going to
Right
be,
timing.
it's the right timing, and we are going to create. This is just the beginning for all of us in all our careers, all our things. We're all moving together stronger than ever. So I'm really excited about that. So how can people connect with you, find you? Go ahead and tell them everywhere they can find you, connect with you, come have a consultation with you, or anything that you want to offer.
Yeah, so we are located at 41 North Federal Highway down in Pompano Beach. Our phone number is 754-432-3653. And our clinic name is Atlas Clinics. You can find us online at www.atlasclinics.com.
Instagram at Atlas Clinics Pompano, and then the Facebook as well as at Atlas Clinics Pompano. And the clinics is plural. We do have one location here in Pompano Beach, and then another one in Palm Harbor, Tampa.
That's really cool. All right. Before we end, is there anything else you wanted to say or share, or something that you want to just leave the listener with about health or chiropractics or about anything that you want to share? I want to leave it open.
Just like, honestly, I got like one just quick little easy good story
Oh, yeah.
that like
Sure.
really
Go for
brings
it.
back to home the importance of health
I
and
love it.
why it is such a priority. But there's a family of 3. There's a dad, he's 39, about to be turning 40, right? There's a mom, she's also 39, and then their daughter is 13 years old. And it's the dad's birthday now, so he's turning 40. And they have a tradition where however old you are, you get that many candles for a birthday wish. So he has 40 wishes now. So he's wishing he's going to get this new grill that he's been wanting. He's hoping he's going to finally shed those 20 pounds. He wants to go on like a sailing trip with his buddies. Like he has these dreams and wishes and aspirations of like what he wants at age 40. Well, fast forward, it's a 13-year-old's birthday, so she's turning 14. She has her 14 wishes. She's wishing that she gets like to finally wear makeup this year. She's wishing that she is going to be able to like go on this camping trip, and like she has all these little dreams and aspirations. Now, fast forward, it's the mom's 40th birthday, 6 months later. The mom was in a car accident 6 months prior, and so she's just been battling debilitating migraines and like sciatica in her back, and she's just been a mess. She's not been able to go to her daughter's soccer tryouts. She's not been able to go on date nights with the husband. Work is becoming excruciating, and she's sitting there looking at her birthday cake, and now they have this tradition, and she says, like, I only have one wish. I wish that I had my health back. And when you have your health, you have so many wishes and aspirations and goals and dreams and things that you want to accomplish and do. When you do not have your health, that's the only thing you want. And so it really brings back the importance of health is a priority, and it needs to be number one so you can get back to doing the things you wish and love. And so I think back to your initial question of why are Dr. Sam and I so passionate, how do we get into this? We both just want to be able to give as many wishes to other people and give that gift, the same thing that was given to us, that pulled us out of that hole. And it's just, we're excited to be here, and come see us and let us help you.
Yeah.
Awesome. I love that story so much. That's a heart story. I
Yeah.
could just sit here and be like, oh my God, yes. Yes, yes, yes. Take care of your health. You know, this is so important. Well, it's been an honor. I so
Thank you
enjoyed
so
having
much.
you both. You guys are amazing, and I look forward to collaborating lots more with you in the future.
Absolutely.
I want to thank you all for joining me today at the World Healing Tour podcast. Until next time, remember to do these 3 important actions in order to connect to positive feelings and positive emotions every day. Number 1, every day remember to have a grateful heart and connect to your gratitude. Number 2, every day remember to ground in love and compassion, first for yourself, and then share that love and compassion with others. And number 3, every day remember that you're not alone. You are guided on this journey, guided by universe, higher power, whatever you want to call it. I call it God. Until next time, have a beautiful day, everyone. Namaste.
Great.
Thank